Time now for this week's Health Matters. Paul Critz, along with physician assistant Lynn Szabo. And this topic this week, near and dear to my heart, is somebody who uses my hands almost on a daily basis. And I've often worried about some of the repetitive things I do. Right. Carpal tunnel syndrome.
Yeah, it's my favorite neuropathy, or
your favorite neuropathy?
Badness that happens to nerves, peripheral neuropathy, nerves being at the end of an extremity.
Okay.
So
I guess you got like just run of the mill boring, like random numbness, but who cares about, but carpal tunnel's a little sexier than that.
Well, it's easy to diagnose.
Oh, okay.
So you got 7.5 minutes, you're off and running.
Good point. All right.
So carpal tunnel is caused by in your wrist, there's kind of a narrowing of tissue, right? And important things go through there, like nerves and blood vessels.
Right.
And a carpal tunnel is kind of a little opening for the median nerve to run through your wrist to your hands.
Okay.
Important nerve, right? Have to make your hands work. And for a lot of different reasons, that tunnel becomes kind of too small for the nerve to go through there cleanly.
What's the tunnel made of?
It's bones and ligaments and probably fat tissue and fascia, I imagine.
All righty.
So fascia is that like stuff you would pick off flank steak because it's too hard to chew.
Yeah.
Connective tissue.
Yeah, the hands aren't really prime cuts when it comes to people.
But they do a lot of things. You know? There's not much in hands that isn't super important.
Right.
If you think about it.
That's true.
So it's really common in women ages 40 to 60. And I wrote in my notes, I wonder why, because I was thinking about, bathroom cleaning and, all that dishwashing and stuff, the domestic duties that cause people to have repetitive. So you have a frowny face. It's really common in professions that women seem to gravitate to,
right? And
like maid and childcare and stuff like that.
Well, and I guess ancillary to that, my mother came up through sort of, although she did not top off as an admin, that was kind of the period that she came through. That she had carpal tunnel, and it was just from all the typing.
Yeah.
So
I think it's like gender duties. Anyway,
okay.
High BMI. Okay, so these are risk factors. History of fractures in the area, which makes sense because part of the carpal tunnel is bones, right? Pregnancy, which makes sense to me because pregnant women in their third trimester oftentimes get extremity swelling. Okay, and diabetes, which
is restriction, right? That's going to restrict blood flow, though. Isn't that what that ultimately is about?
It could, and that is part of this, but the big restriction is compression of the nerve.
Sure. But what diabetes brings to it is
well, diabetes tends to cause damage to delicate tissues toward the extremities of the body.
And how does it do that?
Because the sugar just takes them out.
Sugar takes them out.
The high level of sugar. That
really, it's like a toxicity of sugar in your cell.
It's called glucotoxicity.
Okay,
and that means a lot of different things, but this is one of them. Okay. So symptoms include numbness and tingling in the thumb and fingers and an aching wrist. But here's what I look for is people tell me it wakes them up at night. That's almost always the second or third thing out of their mouth.
Wow, okay.
Yeah, it wakes them up at night. And they also note that they become clumsier. So they're it's harder to hold a pencil or a pen. It's harder to hold a cup of coffee. Things like that. They don't really have the strength to do that. They're dropping things.
Okay. So I have, all right. Okay, well, we'll get to my problems in a let's finish up the general.
Well, your tendon glory is a little bit related. Anyway, the entrapment of the nerve, so the compression on the nerve, starts by cutting off the blood supply that's innervating, or that's vascularizing the nerve, right? That's supplying the nerve with blood. Okay, so that goes first, and then the pressure is directly on the nerve.
Okay.
And this causes signs of hand atrophy on exam. So you can actually see changes in the structure of your hand. Yeah, we'll get to that in a minute because my favorite word is involved in that.
Oh, fun.
Yeah. So how is it diagnosed? Super easy to diagnose. I already said that. First of all, the history is super straightforward. Second of all, patients have an awareness oftentimes that this is what they have. And they're able to kind of come in saying, I think I have this.
It's kind of it's in like popular culture. People are aware of it. Are there other like sort of competing syndromes and other things that can mask and be that or represent themselves in similar fashion?
Yes, actually, paresthesias, which means numbness in the extremities. Like, for example, my favorite diagnosis was they found a woman who had mercury poisoning.
Oh, wow. Okay.
In the county, and she happened to.
I think you've talked about her before. I think she's kind of this weird patient zero in your personal mythology.
Right. Yeah. So, so there can be other things. B12 deficiency can cause paresthesias. Diabetes can cause paresthesias in of itself. And probably other nerve damage during fractures and things like that. Probably surgical mishaps. I mean,
just damage done to a nerve.
Yeah, that's kind of like collateral damage from some kind of hand surgery.
Oh, okay.
So here's what I look for, and these are my favorite words. So I look for atrophy of the thenar eminence.
Of the thenar?
Thenar eminence.
The thenier. It's like the near is how it's spelled, but it's the
probably
thenar
somebody's
eminence.
Name. Yeah. Dr.
Wow.
Thenar.
Dr. Thenar, your eminence.
And so what that is kind of at the base of your thumb, where your thumb and your wrist come together. That's your thenar eminence. And actually it gets atrophied because
Wait, what is it again? Do it again. I was finding our place in the notes here.
You want to find your thenar eminence?
Yeah.
It's on your palm, base of thumb, halfway between base of thumb and wrist.
Okay.
That little puffy thing?
Yeah. That's your thenar. Okay, and that's what atrophies?
Yeah.
Wow.
Yeah, it atrophies and you can see it on exam. It's kind of cool, and it makes you look cool when you say, well, of course you have atrophy of your thenar eminence.
Yeah, this is easy.
Yeah. Decreased grip strength, which is super easy to
see.
test.
Now here come my favorite words in your whole.
I know, here they are. These are old dead doctors who donated their names. There's a Tennell's test that you can do and a Finkelstein's
test. What are these tests?
So a Tennell's is where the provider takes your hand and leaves it in kind of a natural position of rest, and palm up, and then taps on the central part of your wrist.
Okay.
That's right between the wrist area and the palm area. Taps on it, and you get a little zing, and the nerve will go zing.
Oh wow.
Yeah.
Okay. Yeah, you feel it all the way up at the end of this finger. Oh, right. Wow. Okay. Neat.
Yeah, that's diagnostic.
Is that Tennell or Finkelstein's?
That's Tennell's.
Oh, Tennell's.
Yeah,
okay, Tennell's.
Get it right.
I don't want to get in Dutch with Tennell's.
And Finkelstein is what you do is you put the backs of your hands together and bend your wrist to a 90-degree angle, so your fingers are pointing down.
Right.
And then you distract them for a while because it takes like 30 seconds, and then they start to get numbness. I'm feeling it now on my left hand. In their fingers, in the tips of their fingers.
Now I can feel it, that warm that turns to numb kind of coming on. Yeah,
so that's charted as a positive Finkelstein.
A positive Finkelstein.
Or a positive Tennell's.
Okay. Like everything's working according, like that's how it should go.
Yeah, we
right?
think like this all the time. And I find it really interesting, as kind of an interesting aside, is there's a lot of a chart note that's old deceased doctor names, like these two guys were probably hand
right, and they came up with this. Oh, hey, if you do this,
they came up with this.
That's great.
Yeah, and super funny, I think.
So decreased. So you have like you mean you don't get the zing, or your fingers don't go numb.
Abnormal is you do get the zing.
Oh, wait a minute!
On the Tennell's, and abnormal in Finkelstein is you start to get numbness in your fingers when you hold them in that position.
That's abnormal.
That's abnormal, yeah.
Okay, but you were saying that that's what happens, and you could sort of start feeling...
That's abnormal.
Uh-oh.
Yeah. So that shouldn't happen in a normal...
In like 30 seconds?
Yeah, about.
Okay, well, maybe I was making it happen with my mind. Well, I don't want to make everybody sit here and wait while they find out whether or not I've got a positive or a negative Finkelstein. But yeah, okay.
You probably have a positive. You have a positive to know. There are no real need for X-rays, and people are kind of surprised.
Really, you can just go, yeah, that's what's going on.
But people. The next diagnostic test needs to be a nerve conduction study, which is kind of, I'm sure you'll all be shocked, a nightmare to get in Del Norte County.
It's funny because It sounds like you're going to be shocked if you get the test. If
That
it's
is
a nerve.
exactly it.
Is that what you did?
R.
You do that pun on purpose?
No,
Is that what
but
it
I
was?
thought that was clever.
That was good.
I thought of about the same time you did. So there used to be at Sutter, and there was a brief period of time where there was a great neurologist there, and he was overseeing nerve conduction studies done at Sutter. And
Wow.
it was too short, too sweet, too short.
Oh, man.
So people get referred down to Humboldt Neurology for these tests, and it's a big line.
Oh.
It's hard. It's not only kind of not convenient to get down there, it's just hard to get it even scheduled.
And so that is like how I read that nerve conduction, like as you would with an electrical circuit, right? So you're testing
Right.
the conductivity
somebody.
of So does every nerve go all at once or what?
No, they're able to target specific. nerves.
Okay, cool.
And I think there's a little bit of pain, but it's not horrible.
Yeah, I imagine that would feel like an electrical shock, that kind of
Yeah.
weird, like super, like funny
Right.
bone feeling.
Yes,
Yeah.
exactly.
Yeah,
That's
okay.
a good description.
Gosh.
But really, the only reason to actually get this,
Mm-hmm.
well, there's two reasons, I suppose. One is if you're considering surgery,
Okay.
and some people think we do diagnostic testing to get the diagnosis, but oftentimes it's done to see if that person should go on to some next step, and it's usually a next step that's surgical.
Right.
So you can't get a referral to an orthopedist for carpal tunnel without having nerve conduction studies.
Oh, wow.
Because they want surgeries. Okay, they're not going to offer you anything but surgeries.
Wow. Okay. So
There is no other treatment. There's no physical therapy because this is an overuse syndrome. Right. So physical therapy, there's no real exercise.
You're not going to extra overuse it to get.
Yeah.
Okay. So really, the only thing. Okay, let's get to this. So surgery is all you can hope for with carpal tunnel. You get the carpal tunnel. That's it. You're
There
not
is
going to.
some
You can't rest it.
There is some treatment that involves rest, and there's probably some yoga exercises too, but I don't know that they're data driven. So
Right.
but so rest is splints, which people hate.
Right.
You should wear them at
Just
night.
immobilized. Yeah.
Right. I tend to try and wear mine at night, and I end up by the morning not having it on.
But is that just basically you're only keeping it from getting worse at that point? Is it actually
and
going
you
to get?
should correct whatever problem it is. Like some of them are self-limiting, like pregnancy. Boom, done.
Yeah, okay.
So,
Boom, done. Happy birthday. Boom,
and
done.
then you get your wrist back. Or, I suppose it may be a correction of your work side, or maybe your computer setup, or something that you're doing repetitively that's making it worse.
Yeah.
But here's what you can do before surgery. This is where a patient in Del Norte can actually do something to make themselves better with no real risk of making themselves worse, and it's easily available. So one is the wrist splints, which you can buy at Walmart. I don't think they're hugely expensive, although you could also go into your provider and get them. Most offices have shelves that have them all ready to go. And the other thing, which is hardly ever used, but vitamin B6.
Really?
So vitamin B6 has long been known by medicine to help with peripheral nerve pain, or nerve pain that's kind of at the end of the extremities.
Wow.
Yeah, I know. It's super cool. You have to take, if you went, to the vitamin store and you were looking for the right dose, you'd probably see 25 milligrams, maybe even 50 milligrams, but you have to take 200 milligrams a day.
Wow. Okay.
Okay. And I think it's probably really hard to get too much B6.
Yeah, I was going to ask if there's any toxicity issue.
Yeah, none that I've ever seen. And I have a lot of people, and I'm starting to use B6 for other peripheral neuropathies. I'm kind of on a tear right now with neuropathies. So,
Oh, no, okay.
So, I've even seen them used for degenerative disc disease and chronic back pain.
Okay.
And there's some data to support their use.
Huh.
So low impact, high yield, easy to do kind of change.
Right. Okay. Low hanging
And if
fruit.
you're like, the whole idea of surgery creeps me out and I don't even want to do it, then at least start here.
Yeah.
See how much you can get.
Yeah, you might get some sort of alleviation then.
And if you wear your splints, which are super annoying because they keep you from doing all the stuff that makes this worse, right? So that's why I wear mine at night. And you can put ice over them too, and that's just extra added pain control.
Right.
Yeah. So I would recommend people that if they think they have it or they know they have it because their doctor was able to diagnose it clinically, and they're not really interested in surgery at this point, could they forego the nerve conduction studies, just back burner them for a while and treat it conservatively?
I guess that would depend on on if symptoms, lighten
Right,
up
that
for
would
them.
depend in their theory of how they want their health care to go and all, what their doctor's willing to cooperate with, blah, blah, blah. But I think that's actually a really good start, and that's kind of as far as my carpal tunnel has gotten, because I don't know, the idea of surgery on my hands makes me nervous.
There's just something, and in folk wisdom, I don't know. Some people call it common sense. Other people just, I don't know. It's just the old wives' tales we used to. But it's like back surgery. Like, don't ever do that. Don't ever cut. Once you cut, you can't go back.
That's true.
Is that true? Really?
That's true. Almost anything. Anything. Taking a Tylenol because you have a headache moves you from
good point. That'll move.
That perfect homeostasis that you came into the world
right.
with.
That's an unanswerable sort of question and a conundrum.
And people have differing degrees of tolerance in their own personal health care for that. Some people love surgery.
Mm-hmm. Like
and
that's
a chance
fix
to
it,
cut
everything.
is a chance to cure. That's what the surgeons
Wow.
say. But they buy into that 100%. And some people are like, ew.
Yeah, right.
I don't want a foreign body in me like metal screws or, sutures or staples or, that's all that creeps me out, So it kind of depends on where your personal theory of your healthcare is.
Right.
So, so surgery is available here. Yay, at Sutter Coast by the local ortho guy.
Who's the local ortho guy?
Oh, God, you're going to make me
I'm
say
sorry.
his name.
I'm sorry.
Well, there's a wonderful, they just started a new PA.
A new one, because there was one who was here for a long, long time, right?
There were two. There's
Okay.
Dr. Bella, who retired. He keeps retiring and then coming back. But apparently he has definitively retired.
This is it.
And I think that, and correct me if I'm wrong, anybody who wants to, but I think his name is Halloran or Hallahan, something like that.
The new guy?
He's not the new guy.
Oh, the old guy.
He's been around for about 3 years, I imagine.
Okay.
The new guy is a PA.
Really? In
Josh
orthopedics?
Mattson.
So you have a PA with like a specialty? Is that what it is?
I don't think he's a specialty, although I think he has an affinity for orthopedics.
Okay.
And I'm sure they're going to train him. I imagine he used to work at Del Norte Community Health Center. He's a really great PA.
Right on.
And got, I guess, seduced away by Sutter. So, and I bet he's going to do all kinds of cool stuff like first assist for surgery and things like that.
Oh, wow.
So, so he's helping out because I don't think a single orthopedist can really make it in this large of an environment, even though we're small.
Can really make it. Oh, you mean there's too much to do?
Yeah, there's too much
Gotcha.
for one, probably even too much for two.
Really?
Depending on what their scope of practice
Well,
is.
okay. Is that like an aging sort of specialty too, or is that
Orthopedist?
Yeah,
Oh no, I think it's a growing kind of specialty.
growing kind of thing.
But they don't do stuff.
I mean for people. I mean, if you have an older population, do you have more opportunity for an orthopedist? is what I
No,
mean.
there's a lot of kids who like break stuff.
That's
and
true. That's true.
surprising amount of complicated fractures in children.
Okay.
So, especially, how do I explain this? There's just some groups of people who let their kids. No, it's not. That sounds judgy, and I don't mean that. Ooh, that sounded judgy.
I'm interested now. What are you trying to say?
Well, I'm trying to say in Humboldt County, I worked commonly with the Mennonite population there, and their kids are in situations on farms and stuff a lot where they break things.
Oh, okay.
And so I just saw a lot of kids from their community with broken bones.
Wow.
I do not want to imply neglect.
No, just a different lifestyle. It's
I think it's a different, more rural lifestyle,
Right.
and more actively. The kids are more active around things like tractors.
And it's yeah. I think there's a lot more human power and chances for them to
it's not. They're
get in
not
the way.
screen kids.
Yeah.
And
helicopter Mennonite parents.
Yeah,
right?
and the parents don't seem they seem like this is normal upbringing to
Right,
them.
right. You got to break bones.
Their tolerance for accidents is they're just really calm about it.
Mm-hmm.
And so that's just something I've observed. I don't think that's a group of people particularly up here, but they're lovely to work with. Their kids are amazing.
Are they really? That's,
Oh, yeah.
They're better. They're polite.
Super cute. They are, and they're very inquisitive. So
Oh my gosh. So how many broken bones did you have growing up?
0.
Really? Really? You made it all. You grew up without breaking
I know
anything?
that's kind of wild. 'Cause
That is kind of wild.
I was active. There was before screens.
Wow.
I was a backpacker. I was a climber. I was a hiker. I fell off of things all the time.
Wow. Well, good for right on.
Yeah, but I never broke anything.
Good for you.
Yeah, I think part of it's genetics, but we digress.
Right.
So surgery is available here, great local ortho. But like overuse syndromes, it can reoccur if you go back to doing the same thing. So you should avoid repetitive stress in your day-to-day activities.
Wow. Okay.
And believe me, you will never appreciate your hands more than when they're messed up.
Oh my gosh. Right.
Yeah.
Right. Yeah.
Now, they think there's a genetic component to this, and I think the genetic component might be related to the Dupuytren's contracture that you
To
have.
the Viking thing, right?
Yeah, his on his left fifth finger, he's got his
pinky.
left fifth finger is partially flexed, and
It's like a 90-degree angle all the time.
Yeah.
I cannot move that. I can close it, but I can't
it's
open
at
it.
the proximal interphalanx. But anyway, if somebody cares, it's what you would call the middle knuckle.
Yeah.
Yeah. And so
Yeah,
they
and
think that a carpal tunnel might have a genetic connection
Wow.
to that underlying genetic problem, which is you report as being Norwegian. So
It's what YouTube told me. Who knows?
Yeah,
It's a
okay.
Danish. It's not Norwegian. So
Danish.
watch it.
Okay.
With the
Although I lived in Denmark, I didn't see any of that. But okay.
well, yeah, but see, look how natural it looks. See, it's the reason it doesn't bother me is the only thing I do with this hand is play guitar, and that's perfect.
You're in position of function for guitar.
I can't stretch that pinky out like multiple frets anymore, but I figure out other ways to play that song. But
that's
yeah.
cool.
Yeah. So as long as I can still play guitar, I don't care what the hand does. So I don't care how it looks.
You're in position of function, which is what is defined in medical school as how you hold your hand to pick up a beer.
Is that position?
That's even in textbooks. It's pretty funny.
That's wonderful. Okay.
So Paul's beer holding is intact. So the next thing is I just wanted to add a little bit of this and that. And flu shots, we're starting to talk about getting them. Our worldview is get them at the end of October. But here is another important insider tip. I think it's important to get, if you're going to get a COVID shot, and I recommend them, that you get your COVID shot the same time you get your flu shot, because the flu shot, for reasons that are super unclear, seems to give more durability and efficacy to the COVID shot.
Whoa.
Yeah, I know.
Never heard that. Okay.
And it is all over my feed, but none of my colleagues seem to know anything
Really?
about it.
Wow. Okay.
Yeah.
Okay.
So
So are they still updating the COVID vaccines?
this is a new updated version to address.
They used to make such a big deal out of all that, and now I have no idea. And so I just go in and go, hey,
okay.
give me the latest.
Yeah. So it showed up, I think, September 1st, a new COVID vaccine. But here's the problem with coronaviruses anyway.
Yeah.
This was understood even before COVID.
You're not going to ever catch up.
You're
right?
never going to
Yeah,
catch up.
Right.
So, but, and you're going to say, but I don't want to get both shots because they'll make me sicker. That's not sick.
That's good.
That's a good immune
That's
response.
like your immune system revving the engine after the tune-up.
That's right. That is what you want.
Right. Okay.
So if that's the way you define your health, you should think about it in October, and you should get them both at the same time.
Okay, so I always shoot for like about by Halloween, right?
Yeah,
That's what we're
Halloween.
doing. Okay.
Yeah,
Okay.
I'm holding out for Halloween. So the other thing is that I asked before we went on the air if there was any update on Mad River Birthing Center. I don't know of any.
Yeah, no, I haven't heard
I
one.
think that a lot of the doctor dreams about joining UHS with Open Door have a little bit of depressing financial reality awareness now. So I'm not sure that that's actually going to happen. But what I have seen is that St. Joe's is doing open houses and trying to make themselves more available for people who might have questions and be considering a birth there. And there's a lot of good reasons to get care there. The first one is they have a NICU there, which is so neonatal intensive care unit. So if there's any baby problems, you're already
right there,
like on the same floor to get care, which is going to be really important at that kind of scenario, I think. The other thing is that I don't know, but I imagine, I'm not in on these conversations, that Sutter is also making plans to increase their, I would think, staffing, OB staffing, because we depend so much on Dr. Kirk and then on other people who are rotating in and out.
Okay.
It just seems like one would hope Dr. Kirk would have all the help and all the resources, including maybe a second permanent OB that he could use.
So why are there just rumors about this happening, perhaps, or how?
Yeah, just rumors.
Okay.
But I'm only the fly on the wall. I'm not really directly involved in any of this.
Well, any sort of increased capacity, access to any
and stability, durability,
Yeah.
I think are really important, because I think I mentioned before in my last week that UHS had 25 women from Del Norte UHS that delivered at Mad River, and the newly pregnant women that I'm talking to you about this situation are pretty much accepting St. Joe's.
Yeah. Right.
Some are accepting Sutter, and a very small number are charged up about going into Oregon, which may or may not be possible depending on insurance limitations.
Wow.
So Roxanne Alsbury is in Ashland. She, the community remembers her, and she's much beloved by this community, and she has offered to do whatever she can, but delivery in Ashland seems a little crazy.
That's a ways to go.
But it's a sweet little hospital,
really?
Similar to Mad River, and they do not take partnership.
Oh, yeah, right.
Is pretty much the end of that discussion.
Yeah.
So, and then the last thing I had was, unfortunately, the homeless clinic today was called on account of staff illness.
Oh.
So they made the two out of the 5 people were sick, and so they made the decision to not do it this year. And I don't know if that matters, because
not do it this year. You mean this week?
Oh, sorry, today. This day. I think it's actually going to change and become more of a Tuesday, Thursday thing down at Del Norte Community Health Center. They're trying to tie it to the showers.
Wow. Okay.
And other community services. So they're trying to improve upon it.
Just to make sure that they're people, because they're fine. They know where to get to that population.
A little bit to the detriment of location, though. If you live in the swamp, it's a little hard to walk all the way over to North Preston, Washington.
There are a lot of people who live in the swamp. Yeah,
a lot. Yeah. It's amazing.
Well, Lynn, thank you very much. I wanted to say it is a confirmation this week that we're going to begin airing on KCIW in Brookings.
Oh, how cool is that?
I believe that's in all 3 markets now. KZZH in Eureka, KFUG here, and then KCIW.
Yeah,
so
3 counties.
Wow. All
Wow.
the way up there. It's a regional reach.
I know. That's exciting.
That is exciting.
It's funny considering this started off so tiny.
So tiny. And how many years ago?
Yeah.
I've got to look in
6 or 7 or something.
It's been a while. Yeah. Just the little 5-minute conversations at the end of a workday down there. That was fun. Yeah. Well, thank you very, very much. And we'll speak again this next week. Any idea what we'll be talking about?
I'm on a neuropathy tear.
Okay.
So
more
diabetic peripheral neuropathy, there's new treatments.
Ooh, I got goosebumps. All right. Thanks a lot, Lynn.
Alrighty.